Good evening, I'm Dennis Ward. Welcome to APTN National News Weekend. Illicit drugs keep killing people across the country, and it's no different in Fort Frances, Ontario. That's where APTN Investigates reporters Kenneth Jackson and Cullen Crozier were just 3 weeks ago, filming their next documentary on sexual exploitation in Treaty 3. This is what they found after less than a couple of hours on the ground. And a warning, this story contains graphic footage that some viewers may find triggering.
Call 911, someone!
Call 911!
This is the space between life and death in Fort Frances, Ontario.
Roll over!
A First Nations woman has overdosed, and her life hangs in the balance.
These haulers need help with anything.
And it's happening here, behind the Family Centre. The daytime drop-in and soup kitchen has been a lifeline in the community for the last 5 years. It's run completely on donations and volunteers who help people suffering from mental illness, victims of sexual abuse, and youth leaving the child welfare system. For Tracy Lockman, it's ground zero of the drug crisis.
They've all experienced trauma to different degrees, and as a result of that, a lot of them have addiction issues. Okay. They're not, a lot are First Nations, and they can't go back to their communities due to breakdown in family units, due to drug use, or there's no housing. There's no housing available in these small communities.
Tents started going up in late April, and Lachlan says she's had to chase drug dealers away. And more recently, people looking to exploit the women.
For a long time, what we saw a lot of was just survival sex. Sex for drugs, sex for money, sex for acceptance. But we're starting to hear about individuals in the area, that whole trafficking aspect. It's like it's evolving.
In fact, as APTN was arriving at the center, Lachlan was chasing a local man away.
Just this morning we had a man coming here. I don't know whether he was looking for sex or drugs. He's here often. We've kicked him off the property. We've phoned the police. The women depend on that. A lot of them.
Is he breathing? You got a pulse?
Moments later, Lachlan gets a call. It's from the father of a woman living in one of the tents. He wants her to check on his daughter. The young woman is brought back only after Lachlan was able to administer 2 quick shots of naloxone.
You saved her life. Like, if you didn't get that call from her dad to go check on her,
No.
maybe we're doing a different story right now.
Yeah.
You have a dead person back there. She was dead.
Yes, she probably would have. She's been through a lot. Her mother died of an overdose 2 days ago.
Her mom died of an overdose 2 days ago.
Yes.
Wow.
Yeah.
This is what you're dealing with. This is just on that level. You're also dealing with predators. Like today, this morning, Trump trying to lure them away or give them more drugs.
Yeah.
Maybe he did give her drugs.
Yeah. Oh, could have been. Yeah.
Because you have proof of him trying to sell patches and stuff.
Yeah. Fentanyl patches.
Fentanyl patches, yeah.
Later that day, a 17-year-old boy was brought back from a suspected overdose. Another life on the brink. Kenneth Jackson, APTN National News, Fort Frances, Ontario.
You can see more of Kenneth and Cullen's work into sexual exploitation in Fort Frances later this fall on APTN Investigates. Red Earth Cree Nation in northeastern Saskatchewan held special services this past week for 5-year-old Frank Young. Frank disappeared from his home near the Carrot River in April when the river was high and moving fast at the height of the spring runoff. There were fears the little boy had been kidnapped and complaints that law enforcement did not issue an Amber Alert right away. In the end, Frank's body was found in the river not far from home. APTN's Leanne Sanders reports.
Frank Young's preschool classmates will be part of the grand entry at a service tonight at the Red Earth School gym. It will also include the search teams who found the boy's body in the Carrot River on Saturday, 81 days after he went missing. Yesterday, community leaders and family held a news conference to thank everyone for their support during the search. Family spokesperson Teresa Whitecap spoke of the family's loss.
I was asked to come and speak on behalf of the people behind me. And I talked about my family circle. I come from a very large family circle. And our circle was broken when Frank went missing.
The families were taken to the site where Frank's body was found earlier this week, and they held a ribbons ceremony there, tying white and blue ribbons for Frank in the trees, signifying innocence and Frank's love for the children's show Paw Patrol. Chief Marcel Head from Showa Lake Cree Nation says the outcome of the search for Frank was not what they had hoped for, and there's deep sadness in their communities.
We hold every member so dear in our hearts, and that they're all important to us. And such like us, Frank, it was important to the community.
Red Earth Chief Fabian Head, where Frank was living with his caregivers, said the high water levels in the Carrot River that runs through the community and where Frank died has posed a hazard for many years, and he took the opportunity to make a plea to the federal government.
Our haylands, our trap lands, our hunting lands are all underwater. We are running out of suitable land to develop more housing due to the high water table. I'm calling on the federal government as well to reopen or file our specific claim for lands owing under Treaty 5 that we, Red Earth Cree Nation, submitted in 1996. With the water levels being that high, consistently high, it's not safe for children to go near the shore. It's not safe for our hunters, our trappers to roam around and trap and fish and gather for their families.
Grand Chief Brian Hardlot is with the Prince Albert Grand Council, which provided support to Red Earth and Showa Lake throughout the search. He shared this message.
I say to our First Nations communities, our First Nations throughout our territories, let's watch over our children. Let's love our children.
Merry Christmas, Frank.
Again, every child matters. And that's kung mamamay ko tayo, I thank the Creator.
Leanne Sanders, APTN National News, Saskatoon.
Forced and coerced sterilization should be banned, and those impacted should be compensated. Those are the findings of a new Senate report. Details after the break. Welcome back. A Senate committee report is calling for forced sterilization of women to be outlawed in Canada. The report released Thursday morning also recommends compensation to victims of the practice. APTN's Fraser Needham has more.
It is one of the Canadian medical system's darkest practices, the act of doctors sterilizing women against their will. And marginalized groups such as Indigenous women are more often than not the victims. A new Senate report aims to end the practice for good. Report co-author Senator Yvonne Boyer says criminalizing the procedure is an essential first step.
I believe there's sterilizations happening today as we speak. The calls that I get in my office tell me that women are still being coerced into sterilization. Women that are pregnant even are being coerced into having that tubal ligation.
Another co-author, Senator Michelle Odette, adds if women know doctors could face hard consequences as a result of the practice, they are more likely to come forward.
If a woman or a family knows that there is a legislation that exists in Canada to protect her, specifically for this, we're giving a voice, dignity, and a chance to make sure that she use her rights.
The senators note accurately tracking the number of forced sterilizations performed can be problematic.
So we've been doing everything that we can to bring as much data to the forefront as possible. However, that's one of our recommendations, is to get a very reliable data system in and to be able to know for sure how many people have been sterilized against their will.
And Odette says since provincial governments have not been successful at stopping the practice, it is time for the federal government to take the lead.
I hope it will send a message also to the region where I live in Quebec, where this mobilization, when it started, the government didn't want to participate. The Quebec government didn't want to participate to this table or to this dialogue.
In an emailed statement, Minister of Indigenous Services Canada, Patty Haidu's office, told APTN forced sterilizations are a troubling violation of human rights, more must be done, and they will be reviewing the report's recommendations. APTN also reached out to the Canadian Medical Association, but they were not able to provide comment by airtime. Fraser Needham, APTN National News, Ottawa.
The RCMP has seriously undercounted the number of murdered Indigenous women in Quebec. That's according to a researcher from the Ishkwe project in Montreal. She says it's because of systemic racism, something Quebec's provincial government says does not exist. Here's Amelia Fournier to explain further.
The problem is that there's a lack of wanting to know if these Indigenous women have been murdered or have been missing and how many.
Janice Cavavoc-Bibeau is looking for missing and murdered Indigenous women who have slipped through the cracks. She's the research coordinator for the Ishkwe Project, a support center and research base for Indigenous women in Quebec.
Passing by the traditional way, by police stations, is a really long and difficult process, and it's often like we don't have much answers, so I had to get creative.
And by getting creative means she had to use archival research and reach out to communities. The result? She identified almost 100 murdered Indigenous women in Quebec from 1980 to 2012, whereas the RCMP reported 46 for that same time period. And that's what Quebec uses when it reports the latest data.
I have a lot of data, but I wonder how much data if I would really have if the coroners, if the police, if everybody really wanted to dig in these findings and these murders to know if was it really suicide? Was it really drug overdose?
She is continually updating her database of murdered Indigenous women in Quebec and wants to eventually create an interactive map of missing and murdered Indigenous women in the province. Cavavoc-Bibeau has also included what she calls systemic deaths in her case counts, like Joyce Echequan, who filmed healthcare workers saying racist remarks while she died uncared for in hospital. 2 systemic deaths were included in her 1980 to 2012 count.
The Legault government doesn't even want to admit to systemic racism, and it's really a problem. Like Joyce Echequan is not a particular case. This is something that happens more frequently than we think. It's just that the clients don't necessarily have a phone to film.
She said that investigations are often cut short when Indigenous women are involved, even if family members or loved ones say otherwise.
Just dealing with police is a really stressful situation, but dealing with police and not even being taken seriously, like that's really heartbreaking. Like if the people that are supposed to help you are not helping you, who's going to help you? So that's when we come in.
She also answers Ishkwe's hotline and accompanies Indigenous people in Quebec with their dealings with the police.
Yes. What's the name of the person who's missing?
Cavavoc-Bibeau has helped Indigenous people outside of Quebec with the RCMP after they called Ishkwe's hotline.
They don't have funding for Ishkwe projects in their provinces, so it's something that is needed everywhere in Canada.
The RCMP, Quebec's Justice Ministry, and Quebec's Public Security Ministry were not available for interviews before deadline. Amelia Fournier, APTN National News, Montreal.
Still in Quebec, it's been over a year since the Nelson family of Kanesatake Mohawk territory filed a human rights complaint over their patriarch's treatment at a hospital just outside their community. They're worried he might not live to see a formal apology made or restitution paid. Lindsay Richardson explains.
These are the things Winston Nelson really loves. His baseball hats, sun on his face, and his wife, Cheryl.
Wave to all the people out in the world. There we go.
They've been inseparable for 31 years.
We used to come home every night. You know, I have supper ready, we'd eat, and then we'd go out either on the gallery or go across the street to the Dairy Queen. We loved it. We loved it.
We used to go play bowling.
Bowling, okay. We used to go bowling too.
But life looks different today. 3 strokes and a list of chronic illnesses permanently affected Winston's mobility and speech. Cheryl is now his full-time caretaker.
Yeah, she does a lot for me.
The Nelsons are no strangers to a hospital environment, but in early 2021, after a stint hospitalized at the St. Eustache Hospital, Cheryl got a call every loved one dreads.
And told me that my husband had a very, very, very sick heart, and that 3 of his main arteries are totally blocked. And I asked, you couldn't give like a stent? Or he says, no. I said, open heart.
Winston was allegedly ordered to live his last days back in Gunazadage, in a house ravaged by mold. Also at issue is how he was sent home.
And my heart, when I saw him coming out of there, I'm sorry. It just, memories that you try to put behind you, but you can't.
Cheryl alleges Winston was discharged in the dead of winter wearing just a hospital gown, socks, and a diaper. His coat and clothing handed to Cheryl in bags.
They took the blanket that he did have on him off of him to bring back inside.
That's as much of an apology as the Nelsons ever received. In an email to APTN News, the regional health authority overseeing St. Eustache Hospital said the incident was investigated internally and found to be both inadequate and insensitive. They claim it's an issue of staff inexperience rather than discrimination. But with the help of the Centre for Research Action on Race Relations, or CRAR, the Nelsons filed a complaint and request for compensation with the Quebec Human Rights Commission. But it's gone untouched for over a year.
It's going to be quite a challenge, and the delay doesn't help. But we're trying to push for the case to proceed, given the health situation of Mr. Nelson.
Quebec's healthcare system post-pandemic is under immense strain. The coroner's inquest examining Joyce Echaquan's death at Joliet Hospital found she was victim to systemic discrimination in healthcare. Niemi says more people are coming forward through CAR with similar complaints. But how do you prove systemic racism is the root of the problem?
We have to look at anecdotal evidence. We have to look at basically stories and reports and the narratives from other people from the same community or from the same group that have similar stories to tell.
The reputation of St. Eustache Hospital is well known within Gunazadage, especially for frontliners like Rob Bonspiel, who runs the community's ambulance service.
90% of the calls that come out of our community are transported to St. Eustache. There's a lot of individuals who have voiced a disapproval as to the service that they're getting at the hospital. This in light of what happened with the Joyce Echaquan situation and the like. Language is a huge issue. That seems to be the biggest factor when it comes to complaints coming from the community.
After Joyce Echaquan died, Quebec announced a number of cultural safety measures to correct these issues, including the hiring of interpreters or cultural navigators. But it's too late for the Nelsons, who say they'll never go back.
You can't do that. You can't do that to people. You can't do that to their minds. And you can't call up people and say, hey, guess what? Come take your husband home because he's dying.
We contacted the Quebec Human Rights Commission for a status update on Winston's file, but they refused comment, citing confidentiality. Cheryl says she'll keep fighting for Winston while caring for him at home. After all, she took a vow, until death do them part. Lindsay Richardson, APTN National News, Gunazadage, Mohawk Territory.
Thanks, Lindsay. Time for another quick break. Coming up, a new life and a sign of hope. Stay with us. Welcome back. A sign of hope and restoration on the Cody First Nation in Saskatchewan. 7 months after several bred bison were brought to the community, they've delivered new life. APTN's Leanne Sanders reports.
These bison calves are fun to watch as they graze with their mothers nearby. But the birth of the calves and the reestablishment of the buffalo on traditional Indigenous land means much more to the chief of Cody First Nation.
Birth, new life, new hope, strength, resilience, all the things that we as First Nations people have endured for hundreds of years. The buffalo has shown us the way.
Chief Cody is also trying to show his people the way. He and the band leadership are pursuing initiatives to give hope to younger generations. One is the recent acquisition of a nearby Hutterite colony. Situated on what was historically Cody land, the colony presents new opportunities.
Our goal is to eventually farm our own land, and we need a base where we can park our equipment to do so. And we want to create jobs, and this property also has a very big community garden. And we have our own butcher shop as well, so that we can use when we decide to butcher the buffalo that we have, so that we can share it without the people. But our main goal is to try to be self-sufficient, so that we can generate enough revenue to subsidize some of the programs that we have in our community, and also to educate our people in how to farm, I guess you could say, and build some partnerships.
It was a partnership with a community development organization that brought the buffalo to Cody. Leader Lima Nanai says as an Indigenous person from Samoa living in Saskatchewan, he saw the importance of the bison to Canada's Indigenous peoples.
The more I read, the story about kill the buffalo, you kill an Indian. That really inspired me to, let's dream about returning something back. And that's why I do, because I want the Indigenous people of the North to be proud of their culture and their identity and where they're from.
For Cody elder Reggie Severite, the buffalo bring joy. Once addicted, living on the streets of Winnipeg, he returned home and eventually got sober. He later worked as an addictions counselor and says it was evidence of the buffalo on their land that offered hope to one man he helped.
He said he was walking along the creek toward the river. And out of the banks of this creek, there was horse sticking up. And when he pulled it out, there was a buffalo skull. So there was buffalo here. And that was his answer. He wanted a sign from the Creator that there is actually a higher power out there.
Leanne Sanders, APTN National News, Cody First Nation.
Great story. That's all the time we have for your APTN National News for this weekend. For news anytime, you can visit our website, aptnnews.ca. I'm Dennis Ward. Thanks for being with us. Enjoy the rest of your weekend.